People of color face tremendous barriers accessing adequate health care, and though this isn't new, the coronavirus pandemic brought the health disparity these communities must contend with into laser focus. Black people were 4 times more likely to die from COVID-19 than white people. But that doesn't tell the full story of the uneven care when it comes to health based on race. Let this sink in. Almost 14% of African Americans reported having fair or poor health, compared with 8% of non-Hispanic whites. Nearly 12% of them were uninsured, compared with 7.5% of non-Hispanic whites. Black infants die at birth at almost twice the national average. Whether implicit or not, bias is baked into our healthcare system. The poor outcomes as a result of this pervasive prejudice range from providing less than medical care, a delay in diagnosis, or a misdiagnosis entirely, increased stress and deteriorating health conditions in patients. The federal and local governments, as well as community organizers, have launched their own efforts to overcome the forces keeping the barriers to health care in place. With over 20 years of experience in healthcare, Jamila Taylor is a policy expert who's advocated for health reform, reproductive rights, and shed light on the disparities in our health system. She is the director of healthcare reform and senior fellow at the Century Foundation, and she's here tonight to dive a little more into all of this. Jamila, welcome to Amplified. And before we fast forward to what's being done to bridge the racial gap that exists in healthcare, I want to spend some time on the barriers that are currently blocking people of color from obtaining proper medical care. First, what does inadequate health care look like? Paint a picture for us of how it might go if you go in for care if you're a Black person versus a white person.
Absolutely. Well, first off, thank you so much, Aisha, for having me on the show tonight. So inadequate health care for African Americans is a grave issue in this country. What it looks like is it looks like us going into our healthcare provider and not being listened to if we express pain or discomfort. It looks like racial bias and discrimination in the healthcare system. We may go in and be treated differently for our healthcare issues, the same issues that a white person may be presenting with in the healthcare system. And it also looks like challenges with affordability and having health insurance coverage in the first place. You mentioned in the earlier segment here that, African Americans are more likely to be uninsured, and that's even in spite of the great advancements that we've made under the Affordable Care Act. So these are all of the ways that we sort of see this unequal treatment show up in the healthcare system, but those are just a few. I could go on and name many more.
Well, I want to make this plain, though, for everyone who's watching, because those of us in policy wonk space, like I was for almost 20 years, we use language like social determinants of health to try to explain or at least understand what's happening that creates obstacles that impede people of color from receiving adequate health care. So I would love for you to talk about this. Is it a lack of access, information, a little bit of both? And, spell that out for us, as well as the consequences.
It's a little bit of both. Health literacy can still be a challenge. And again, I look at health literacy as also an access issue, right? We're talking about access to the full spectrum of information about health conditions that we may be experiencing, or a loved one could be experiencing. So access issue is key, but it's also about whether or not we can access the healthcare services in and of themselves in the first place. African Americans are more likely to live in residential areas that don't even have access to a health provider in the first place. And so the literacy piece is important, and so is the services issue. And I think I'll also say too, look, the social determinants of health are important indicators. There are conditions within our environments that can dictate how likely we are to have access to healthcare services or live healthy lives. But in my opinion, racism is really the issue that's sort of undergirding all of these health disparities that we continue to see, again, even despite access to health insurance coverage.
Well, the federal government is intent on solving this ongoing problem. The Healthy People 2030 framework is the newest iteration of a program that started back in 1979 with the intent on improving the health and well-being of all Americans. This time around, they're emphasizing eradicating health disparities, achieving health equity, and promoting health literacy, among other things, all of which disproportionately affect people of color. So how do they plan on addressing these things?
Well, the Healthy People 2030 is an important framework. If I'm not mistaken, I think the last time it was updated was in 2018. So it's important. It has clear markers for addressing things like health literacy, as you mentioned, health disparities, really promoting general wellness across American populations. I will say, though, that there have really been some important advancements in the policy space that have been made over the last year or so by the Biden Harris administration. Things like putting additional funding into addressing issues around implicit bias by training healthcare providers, pulling millions of dollars into addressing this country's disparities in the maternal health and infant health issues, as well as one of the first actions that President Biden made when he came to office was issuing an executive order on racial equity, really calling for a whole of government approach to addressing systemic racism, including through agencies like the Health and Human Services. And the CDC actually, for the first time ever, declared structural racism as a public health threat.
I was just about to ask you if the goals of the Healthy People framework could actually be accomplished without addressing the implicit bias contributing to the subpar health care that people of color receive. And it sounds like the response and the policy measures that this administration has put forth, clearly in reaction to the COVID pandemic, which just exacerbated all of the disparities that already existed, are focused on how you tackle that bias. I'm curious what that looks like in practice, though.
Well, first off, I think it's important to, conceptualize the fact that we do have to train providers. We are talking about this issue around racism and mistreatment in the healthcare system is something that can really be traced back, in terms of the history of this country, all the way back to slavery. We saw medical experimentation on Black bodies and medical mistreatment way back then. And so it's really something that is a part of our healthcare system, unfortunately. So we really need targeted strategies to train providers in the process of those trainings, making sure that they're actually working within, and among vulnerable populations, the populations that they're going to be serving, and to be really proactive in ensuring that we are putting forth anti-racist health policy as well as our medical practices.
This training end of it is so fascinating to me. We actually just covered how we're seeing the enrollment of Blacks going into the medical professions and medical school in particular increase, which is great. So you figure you have more people that come from our communities who ultimately practice in our communities. That helps. How you train the existing medical establishment of white folks is fascinating, given that we are in a time where there's such a backlash around quote unquote critical race theory, which really isn't what the backlash is about, and an attempt to derail training and education that is race centric. And I'm curious, what are you seeing happen and play out in the medical field with regards to having some kind of racial justice incorporated or racial sensitivity training incorporated there?
Well, it's happening, but not enough, and I think that it's important for us to think through the fact that, it doesn't matter where a physician may be in their career. It is never too late for them to learn about how bias and racism impact patients in the healthcare system. And then I think to relearn and retrain in a way that will help get rid of this challenge. I'll also say, too, that part of the conversation around, sort of training providers and making sure that everyone is getting this training, not only physicians, but also folks in the front and back office, really Black providers have really taken the mantle on this and, really calling for change within the healthcare system. They've also taken an active role in conducting the trainings themselves. So I think that is really going to be key in moving forward. It's always great to have more providers of color, particularly Black providers, being trained and working in these professions, but it is everyone's responsibility to make sure that healthcare is safe and respectful of all people and that we root out racism in the healthcare system.
So in our last minute, tell us, what can advocates on the ground do to continue to amplify this conversation?
Well, advocates have really been fighting to ensure that healthcare is a human right for decades now, and the fight continues. I'll say too that this fight is happening in the backdrop of the fight at the ballot box to ensure that voting rights are maintained across this country. So I would just call on advocates to keep up the good fight. Also make sure that the folks that we are electing to hold office are held accountable when it comes to the issues that we care about. Healthcare access and affordability is one piece, but there are also a number of social justice issues that have a disproportionate impact on communities of color, and we all need to be holding these elected officials accountable for that.
Jamila Taylor, Director of Healthcare Reform and Senior Fellow at the Century Foundation, thank you again for coming on Amplified tonight. Appreciate your insights.